Hi, I'm Associate Professor Siang. I'm a plastic surgeon at Singapore General Hospital, and I'm currently the head of department at Singapore General Hospital Plastic Surgery Department. I'm going to answer some questions about plastic surgery this morning, and hopefully this clears up some of the misconceptions that everyone has about plastic surgery. Plastic surgery in a public hospital setting is very different from what you guys know from watching Nip and Tuck and what you see on television. In summary, plastic surgery is very wide-ranging. We do reconstructive surgery, we do cleft lip and palate for cleft patients, we take care of the burns patient as well. And then of course there's the aesthetic surgery, which everyone knows very well, the eyelid and the nose jobs and the so-called breast enlargement procedures that you guys often read about. So yes, we do that as well in Singapore General Hospital, but that constitutes probably only about 20% of the workload. Plastic surgery is not only about beautifying a person. By correcting whatever deformities they have, it actually helps restore a patient's self-confidence, and it goes a long way to boosting their self-confidence and how they portray themselves, how they think, more importantly, how they think other people are looking at them. So there's that self-confidence element to it as well. It's not just vanity, okay? Is plastic surgery any less important compared to other specialties like neurosurgery and orthopedics? I don't think so. As I described just now, orthopedic surgeons fix the bone, neurosurgeons fix the brain when there's a bleed and so on, but we fix things that are missing. And truly, these patients have a condition that needs fixing as well. So it's not just about the vanity, again, I emphasize. So I don't think we're any less important. We play a very critical role in the group of patients, in cancer patients, in patients who have undergone road traffic accidents and all that. We play a very important role in their recovery. As we always say, plastic surgery is a surgical specialty that treats both form and function. So a lot of times we do not just restore the form of the patient, we restore the function as well. For example, as I described to you earlier, the cleft lip babies, they can't feed. So only through after surgery that we've done for them, they can actually perform a normal function like feeding or drinking milk. So we do play a role in restoring function of patients on top of the form of what they look like. Okay? What are the most rewarding aspects of plastic surgery? It's like to essentially restore a patient back to what they were. Yeah, I think that's the most satisfying part. A lot of these patients have gone through a lot because of their cancer, of their accidents, and because of what they're born with. To be able to restore them to what they were previously, or for them to be able to function normally like any normal person, I think that probably puts a smile in all the plastic surgeons' face to be able to help these people to gain back normality. One of the worst things, it's not really a bad thing, it's just that a lot of these complex operations that I described to you just now, they actually take a very long time. So some of these reconstructive surgery operations can take 10, 12 hours, and we usually only start after the cancer surgeon has taken out the cancer. So we start like maybe in the afternoon and we don't finish past midnight. Case in point, we had a surgery that went on for more than 36 hours just last Friday. It took the cancer surgeon about 12 hours to take out the tumor and took us another 24 hours to fix it back. So it was a total of 36-hour operation. So you guys are going to ask, how do you guys actually last for 36 hours? We actually work in teams. There are different teams of surgeons and we take turns. So we may not be the one operating for the full 36 hours. So we take turns to have breaks on and off. But we tend to be involved in a lot of these major operations that take a very, very long time. So if you imagine complex operations like that, the most difficult part is the sewing of the blood vessels together, and these blood vessels are only about 1.5 millimeter in diameter. It requires very technical skills, and then we use sutures that are even finer than your hair with the help of a microscope. So these are all very technically challenging procedures that need years and years of training to get where we are. Yeah. The next question is it worth it being a doctor? having to go through the process of medical school and the tuition fees and the long training and so on. Medical school usually takes about 5 to 6 years, and as all of you would have heard, medical school is a lot of studying. Yeah, you would be studying 3 or 4 times harder than your friends who are doing other subjects. So you get very little holidays as well. In year 4, year 5, you get practically a month at most, or if less, holidays. So you're perpetually studying compared to the rest of your friends who are studying other subjects. But that's actually the easy part. It gets busier when you are housemanship. In housemanship, you have to do calls that usually last 30 hours or more, sometimes with little or no sleep throughout the 30 hours. So how it happens is that you start work, let's say 7 o'clock this morning, you are called at 9, and you worked all the way till lunchtime the next day, which makes it about 30 hours. And then you go home and rest, and then you are back to work again the following day. So the hours are very long. You get very little rest. Your social life definitely takes a hit with all these kind of working hours, because you just don't have the time to go meet other people. And life pretty much revolves around the hospital and the people you meet in the hospital. And then as for the specialty training as well, it's equally tough, because especially for surgery, I would think, because the hours are long, but then there's no substitute for being around for surgery. So if you're thinking of, I want to be a good surgeon, but I don't want to spend too much time in operating theatre, that doesn't happen. Because all this learning comes from experience, and the hours you spend in operating theatre, there's just no shortcut to learning. You can talk about virtual surgery or reading about a textbook and all that, but nothing beats actually doing the surgery itself, experiencing the difficulties, and seeing some of the complications. So all this require you to be around the hospital and working long hours. Specialty training itself can range anywhere between 6 to 10 years after graduation. So you would normally graduate from medical school about when you're in your mid-20s, and then you spend another sort of 6 to 10 years training to be a specialist. So in general, the more popular specialties like plastic surgery will be harder to get into. So you may have to wait around a while before you actually enter the specialty training. And once you're in specialty training, it takes another 6 years or so to complete it. So most of us actually qualify as specialists only when we're in our mid-30s. And of course, during this period, your salary will not be as much as someone who is doing maybe some other careers, or someone who is chosen out to be a general practitioner who went out to be a GP much earlier. So you will not be earning as much as these guys in this 6 to 10 years. You've been working much longer hours compared to them. So I think at the end of the day, I personally have found it more satisfying to be a specialist, because you're doing less routine work, you're doing more challenging work, you're doing work that can make a bigger difference compared to just prescribing cough and cold medicine and writing out medical certificates for people who don't want to go to work. So, but all these come at a price. Even after you qualify as a specialist, when you're a surgeon, you operate on someone, you go home worrying about the patients that you operated on, worrying about what if they develop complications. And when they develop complications, it doesn't matter whether you're on call, you have to come back and sort it out, because it's the operation you did. So there's no real break in that sense. It's constantly on your mind. You cannot do a big operation and go home, have a nice cold beer and knocked out, because it doesn't work. Something can go wrong in the middle of the night. And if something goes wrong, you will have to come back and sort it out. So therein lies a lot of responsibility to take on something as challenging as that. But with responsibility and the challenge also comes more satisfaction, because this complex stuff can only be done by someone who has done all the years of training. It cannot be done by any other doctor. Okay, so I think if you're someone who relishes his challenges, who wants to make a difference, I think all this hard work will all be worthwhile eventually. And the sacrifices you make along the way, be it in terms of the lesser amount of money you make, the longer hours you have, and the social consequences of it as well. Do doctors always wear stethoscopes? Obviously, I don't wear one. If you want to break specialists into 2 big groups, there's surgeons who do operations, and there are physicians who don't do operations. They treat patients by prescribing medication, doing blood investigations and x-rays and so on. So Generally speaking, the physicians or the medical specialists are the ones who carry the stethoscope around because they need to listen to the heart, the lung, and all that. The surgeons are the one who do less of this, so we don't carry stethoscope around. We spend a large part of our time in the operating theatre, so we don't need the stethoscope in the operating theatre itself. Being a specialist or being a doctor is a continuous learning process, okay? The learning doesn't stop at medical school. If you ask me, it gets more intense after that as well. Even after you qualify as specialist, you continuously have to learn because medicine is a rapidly progressing field. There are always new operations that are being described by other people, new discoveries being made. You have to keep in touch by either attending conferences, reading journals, or interacting with foreign surgeons through webinars or conferences and all that. It's a continuously learning process. And nowadays, a lot of my juniors actually learn their operations through watching YouTube as well. So that's a perfectly acceptable way of learning now. There are a lot of surgical videos on YouTube that you can watch or other channels that you can watch to learn how to do new operations. So that's how we learn. It's a continuous learning process. A lot of people don't have the opportunity, especially with COVID now, to attach themselves or to hospital attachments and all that. To be honest, hospital attachments, I know I'm not supposed to say it, but hospital attachments does not make that much of a difference in the end in your application because it's usually a very short stint and you guys don't really get to do very much. So if you ever get to do one, the most valuable part of hospital attachment is to actually talk to the doctors and see what their life is like, the hours they keep, and so on. The last two questions, number one is what advice do you have for someone who wants to pursue medicine or pursue career as a surgeon? I know it's very difficult when you're 18 or 19, when you're a JC student, to really decide what you want to do for the rest of your life. Okay, my advice is talk to medical students or junior doctors, get to know some junior doctors and find out from them what life is like, and then talk to their senior doctors who have been through all this and see whether they think it's worth it. So by talking to people and finding more about it before you actually make a huge commitment to want to study medicine, I think that really, really helps. Ultimately, what is really required is commitment to see through the end. I always ask myself, is it a job that you can wake up to every morning and still want to go to work? Okay? And after having done this for the last 20 or 30 years, I can still motivate myself to wake up every morning. I still find meaning in what I do. I've moved on to a slightly different phase now. I'm more sort of mentoring the younger surgeons rather than doing a lot of the operations myself. So there are different things you can do along the way. When you're training to be a specialist, you want to be really good in an operation. But when you reach a more senior stage, you can also find joy or satisfaction in mentoring your younger colleagues, training them, and see the satisfaction of them becoming good surgeons and good doctors as well. So that's where I find the most satisfaction. So I may not have gained the most in terms financially by staying in a public hospital, but I find a lot of satisfaction in mentoring a lot of these younger doctors and surgeons. Decide for yourself whether you're willing, you can make this big sacrifice in terms of committing your life to it, be willing to study hard for the rest of your life, make some social sacrifices, and some financial one as well, because your friends who are going to develop an app or start a IT company is ultimately going to earn a lot more than you do. Okay, so it's a comfortable life, okay, but you won't be mega rich. Okay, so which brings me to the last question: are plastic surgeons actually very rich? The short answer to this question is plastic surgeons working in public hospitals are comfortable and not mega rich. Okay, there's some plastic surgeons in private practice who are probably a bit better off than us, but you will never be in the realms of people who own the IT startup companies, who own companies, or the big time investment bankers and all that. It will not be that kind of salary that you're talking about. I'd like to thank the NHMed Organizing Committee for inviting me to speak. This is my second or third time doing this. I hope I've cleared some misconceptions of what plastic surgery is all about, given you some valuable insight of what being a doctor and a specialist is about and what the training is going to be like. And I'll be happy to answer any, you guys know how to get in touch with me. Happy to give you guys talk in the future. Okay, see you and stay safe.